Hi everyone, I'm Dr. Sharma from Orthodontics. Today we're going to talk about how we treat the most common problems that we see in the office. And what better place to start than with crowding? By far the most common problem that we see. Every time I see a crowded case, I have to ask myself, how am I going to make enough space for these teeth to fit into the arch? There's four main ways to create space. First, expansion. Expansion is just like the word indicates. It's a matter of expanding the jaws to create space to allow the teeth to fit in. You have to be careful about matching the jaws together, so it's not like you can just overexpand the upper, not to match the bottom. That's always the most important part, that everything has to match up. Secondly, we can reshape the teeth a little bit. What I mean by reshaping is basically in between where the teeth contact, we lightly reshape anywhere from 0.2 to 0.4 millimeters to create enough space for unraveling the crowding. Now it's very important to note, all the amounts of reshaping that we do are based on research. Even then, we stay about 10 to 15% less to give us a safety buffer zone so we don't create issues like sensitivity. Thirdly, what we can do is we can create space by pushing teeth apart. Now there are many different appliances that we can use to do that, but the point is, in between teeth, we just create space to allow other teeth to settle in that space. And lastly is extraction. Now nobody truly looks forward to having a tooth removed, but sometimes it's totally necessary, and it really depends on how severe the case is. The more the crowding, the more likely the chance that you may have to have teeth removed. And it's actually pretty common in treatment. In our office, we probably do it anywhere from 10 to 20% of the time. Overall, with crowding, the most important point that we want to consider is to put teeth in the proper place in bone so that it's healthy and stable for the long term, and we don't want to create an issue where we're overstuffing things together, because that compromises the gums as well. So we want to give you a result that's stable, that looks good, and is healthy for the rest of your life. Next, let's talk about spacing. As the name indicates, spacing is the exact opposite of crowding, where space exists between teeth. Whatever the reason, it's important to know why spacing exists. For example, some people have very small teeth. In those cases, in addition to doing braces or Invisalign to close the space, we may have to involve the general dentist to do some bonding on the teeth to just give them the shape and size that they should have. If there's missing teeth, it's important to decide if we can close the space of the missing tooth or if we have to replace it. Again, replacing the tooth will involve your general dentist to determine what's the best option for you, whether it be an implant, a bridge, or just a filling. Next, we're going to talk about overbite. This is easily the second most common problem that patients or parents complain of. Overbite is technically known as overjet. So for the purpose of this discussion, let's use the term overjet. Overjet is simply defined as an overlap of upper teeth beyond the lower teeth. So if we look at this model, this is an overjet. Now, with overjet, there are two main components to this problem. A dental problem, which means teeth, and a skeletal problem, which means the jaws. Now, part of this overjet is due to the jaw, the lower jaw being further back than the upper jaw. And a part of this problem could be due to the upper teeth being too far out. Which one it is really important to determine in order to come up with the best treatment plan possible. It's important to note that whenever you're correcting overjet, there are usually facial aesthetic considerations as well. So you really want to make sure you know which one is the cause before you try to correct the problem. More so than other treatment considerations, in overjet, it's more important to evaluate the total overall facial aesthetics. You wouldn't want to push the upper teeth too far back, and you would not want to push the lower jaw too far forward. So the ideal balance is going to be very important to achieve, not only for the teeth and the stability of the jaws, but also for the facial aesthetics. The most important factors about treating overjet is coming up with a proper diagnosis. Once a proper diagnosis is made, then a proper treatment plan can be made to give you the best dental and facial aesthetic results, as is always the goal.